Hi, my name's Olga Havnan. I'm the CEO here at Danila Dilba, and I'd like to welcome you as a new member of staff to our organisation. Danila Dilba has been around for more than 25 years, and as an Aboriginal primary healthcare service, it can probably be quite a daunting and challenging organisation for people who are not familiar with working with community-controlled organisations like ours. We'd like to thank you for taking that opportunity and taking up that challenge to come and work with us. And I think what I'd like to also say is that I hope you find this particular introduction to Danila Dilba giving you some sense of our history, where we've come from, and the people who helped set up the organisation. Enjoy your time with us. Please, have the confidence to come and talk to other members of staff or to me or to other managers if there are things that you don't know or understand about DD. And we hope that your time here with us will be long and enjoyable. Thank you.
So it was part of a much wider movement, not only national but international. It was a really long battle.
We need to be able to provide culturally appropriate primary health care services.
We had to get our people to stand up, and be part of the community.
The Danila Dilba that we have today is light years away from what it was in the early 90s.
It's about us self-determining what we want to see happening at the service.
The health worker is the heart and soul of the clinic.
My earliest time with Danila Dilba started in the late 70s, really, and I was working as a field officer in DAA, and the concept arrived when I was a field officer at DAA about the need to have our own medical service, which was, being established around Australia and particularly Sydney, that had a model. It was a great concept of what I saw in Redfern.
In 1974, when Cyclone Tracy hit Darwin, a lot of Darwin Aboriginal people, like everybody else, were evacuated, and a lot of our mob went to Adelaide, and I think some to Congress, some to Alice Springs, and they were met there by the local AMS, the Aboriginal Medical Service in Adelaide, and Central Australian Aboriginal Congress in Alice Springs. So people were impressed with the services and the support and assistance they got from those Aboriginal organisations. So as when Darwin people came home, they thought, how come we haven't got our own Aboriginal medical service?
Well, because we had been exposed to what was happening down south as a result of the 1974 cyclone. You had a personal contact with what was happening in Sydney with a lot of people.
Actually, Redfern was quite a centre for Aboriginal people coming in from rural areas, and they particularly congregated in Redfern. And the situation with regard to services was similar to what was happening up here or not happening. And then after that, things like, the health services, the legal services, these were set up to answer the needs of discrimination, legal services to deal with what they perceived as police harassment. And, it was a hive of activity down there, setting up black theatre, there's a dance company, all sorts of wonderful things flowed from that time.
During the 70s, and during that period, there was a whole lot of activism that was happening, not only here in Australia, but across the world. Things in America were happening. I can remember, listening to the radio and hearing about the people in Victoria, in Melbourne, organising the Aborigines Advancement League, and a whole lot of people were attached to that. We were putting out magazines, I think there's a lot of them here, called Dawn and other things. There was Martin Luther King in America, and then Malcolm X, who was quite influential, in fact, and everybody was reading Malcolm X at the time. And of course there was the end of the Vietnam War, the moratorium.
We're very involved people. They called us the Ever-Readies. Anybody can go down to Sydney tomorrow or whatever, who can go, this one. And it was like that. We were called the Ever-Readies, and that was nationwide. Whoever was available to go to this important, conference down south, get on the plane and go. And it was just as hectic as that.
So there's a whole lot of things that were happening in the world, and Aboriginal people here in Australia were listening and being influenced by this, and of course eventually it got to little old Darwin. So it was part of a much wider movement, not only national but international.
For a long time, there were a number of us that wanted to have our own community control medical services because of the obvious reasons where we were going to the hospital and we felt that we weren't getting that type of service that we should have been getting because of cultural reasons and that sort of stuff. And I guess in a lot of cases, a lot of our mob weren't going to the hospital or seeking doctors.
Well, you all had to go to the Darwin Hospital, just like what happened in the other centres, is that you lined up with the population in the public hospitals, and it wasn't suitable. It just wasn't suitable for people who had second and third language and multiple languages other than English, and for those of us in the urban community who came from institutional backgrounds.
Like anything that was emotional or anything that was anything other than medical, it just went by the wayside. We had some sick people. I mean, we still do have sick people. And I don't mean medically sick, maybe mentally sick. Disadvantage can cause many problems. And that was it, and it was the way they were treated. I mean, we'd go and sit down in the waiting room in the Darwin Hospital, and it was demeaning and it was not nice. And the people would get up and shamefacedly walk with their head down, and it wasn't a good service to Aboriginal people.
And all of us can remember those times when you'd go to the Darwin Hospital and sit there and wait and wait and wait and wait and wait, and they served everybody around you, but because you were an Aboriginal or known to be an Aboriginal, they would just let you wait. And I remember sitting there one day and I was really sick. I was with my dad, and I just vomited everywhere because they left. My dad had a big argument with them, and this was how we were being treated all over Australia at the time, and sometimes it still happens.
People tend to refer to it as shame, people for a whole range of things, but I don't think it was shame. It was just they didn't know the people, and obviously we provide a much more friendlier place, and that's from what we learnt from other community controlled health services, because we did start a fair bit behind, but that's what it was. And just having that setting where people felt comfortable and felt that they were going to get a good service. We don't pass judgment on the clients. We're there to provide them with the service and options for them to improve their health, and that's the role that we play. And I think it's a very good model, because our numbers increased quite substantially, and that's a good indication of the service that you're providing is meeting the needs of the clients.
The reason why the men's clinic was set up is because we was hardly getting any Aboriginal or Torres Strait Islander males coming into the clinic. The men's clinic was set up in 1999. This place here was actually Danila Dilba in itself in 1991. So this was the first Danila Dilba health clinic. The whole idea of making this place a men's clinic, this place is actually a house environment. So it's an old house that we've arranged to set up as a male's clinic, and the guys love it. They come in, they feel at home. There's no pressure on them. We in the reception room, you get we got some guitars and the dart rooms and that, so they can muck around and while they're waiting, even have a yarn and play a song or so. And they also got we got TV there, so they can watch videos and also some food and drinks as well. We are getting men to coming in. We are getting men to access this clinic to help themselves. And this clinic mainly consists of chronic disease clients. So people with diabetes or hypertension and that, we mainly service those guys, but we also do acute when guys rock up with maybe say a STI or something like that.
We want the money to come directly to Aboriginal community controlled services so that we can get on and do the job that we're best at. We've got the track record and we've done it. So let's go and give these bastards hell.
Yes.
It was a really long battle, and I mean people did petitions, they lobbied, they complained, they spoke to everybody, they had interminable meetings, community meetings. So it just went on, and that's what I describe about this energy and support that Danila Dilba had. It was more or less unwavering from the local community until I took it over in 1994, and then it continued while I was there. So they did everything and anything and spoke to anybody and everybody and harassed people and, just kept talking and doing all kinds of things, like I say, petitions, lobbying, letters, and so on and so forth.
When I came back, I did start just holding meetings to discuss this issue with the community, and I think the time was ripe because they were well attended. There are lots of people still around in the community who were part of that.
What the anti-government didn't want was a service such as that, because it was being seen as being radical and what was wrong with the existing service that we deliver now. And so what they gave to us, which another group of people took over, was a transport service. So we walked away. Well, we wanted to revisit the concept, and I did that with the late Sally Ross, and who was from Alice Springs, but she worked as a health worker in the Katherine region, and I knew the population here in the Darwin region. And so we chose to set up a committee, a board of people who would be able to, direct and look at establishing such a service. And that's how it all started. I did Rhonda Kelmer and myself, who worked in the town camps, we did a survey in the town camps of the attitude to gauge an opinion of those people in the town camps as to whether they would like to have their own medical service. And they agreed. They didn't want to go to the hospital. They were happy to have our own medical service.
So the Larrakia people gave that name to the service, and of course lent their support and energy by doing so, which is very reaffirming for the Darwin community, that the Larrakia people were actually saying, by giving us the name, we're behind you. So that was a really good positive thing for the Darwin community. I've always been really proud that there's that association. There's a whole lot of different Aboriginal people live in Darwin as a result of the stolen generations and what have you. Although we've been there for generations, the Larrakia are the traditional custodians of the land, which is now called Darwin. So that was really nice.
I manage two of the clinics here in Darwin City. Part of that role, I'm responsible for the overall management and development of the clinical. Also to provide guidance and direction to staff when required. We also, at this management level, we deal with strategic planning. Once approved by board, I then take that to the operational level and get it operationalised within both of my clinics. Here at Nucky Street, we have multiple things going on out here. We have a general clinic for walk-ins. We've got doctors, nurses, health workers. We also have a chronic disease stream where people come in for their annual checks and reviews with the doctor. We also have visiting specialists.
I suppose for me that the reason why we need separate Aboriginal health services for our communities is because we need to be able to provide culturally appropriate primary health care services. For me, with my own personal experience with my family, it's very hard to try and get our mob to go to the doctors, to not feel intimidated or to be scared. Often I find with my family I need to accompany them to appointments where it's with specialists or the hospital, whereas with a place like Danila Dilba, it's actually quite welcoming. They feel familiar with the people that they're seeing, and they feel that they can open up a bit more about the health problems that they're facing.
Yes, I think that was the basis for setting up a separate service. I think, first of all, there are cultural factors. Some of the people from communities at that stage, and even today, don't have a good grasp of English language. Some people do, it's remarkable. But at that stage, there was that language barrier, the cultural barrier as well, because I think, what we call long grasses today, I'm sure there were people, even at that stage, who, were living in the long grass with no access, to health services, showers, all that kind of toileting thing. Really embarrassing for people to have to, go to a white service where they would feel very, shamed and ostracised. So that was one of the reasons. Another reason, I think, was a feeling of pride that, you had the capacity to run your own services for your own people. And it was a good access to employment for a lot of Aboriginal people because, prior to that, most health services have been staffed by white people. And again, that was that same thing of powerlessness, I think.
I think the reason why Darwin people at the time really wanted our own service was that it was a very strong act of solidarity and self-determination, and that what was wrong with us? Why couldn't we run our own services like all these other Aboriginal people? So I think it was a strong call and a strong form of solidarity and an affirmation of Aboriginal people and self-determination and self-management, and we can do the same as anybody else. So I think it was a very conscious political movement as well. Yes, Aboriginal health, of course we need it, for our health reasons, but that was sort of behind that. There was this other political movement to assert ourselves in the name of self-determination, and that hadn't happened to that extent in Darwin, and there are other stories in the past.
We had to get our people to stand up, and be part of the community, but through their own initiative, and because they needed to do it, not someone having to do it for them. So that's how community control forged the way for Aboriginal people around Australia.
I originally came here as a student in 2005, and they showed me around all their services, which I thought was really good for what they were providing to the community. So I wanted to come back and be a part of those services to help the community. Yeah, so that's why I came to work at Danila Dilba. The best part of my job is helping people. I've always wanted to help people, get them by in their times of need and just provide better health opportunities for them.
Setting up the organisation, in the very early days, there were a number of non-Aboriginal people who provided very good assistance to the community, including some doctors who are still available or still employed by Danila Dilba even today. And I think, you know, they're probably the repositories of wisdom, having been there for so long.
I've been at Danila Dilba for 23 years. There are lots of reasons for that. It's an incredibly interesting project, watching a health service grow from nothing to a big organisation. Local people had fought very hard for an Aboriginal health service to be established in Darwin. But when I did start, it was still one little old building in McLaughlin Street, a desk, a telephone, several copies of the National Aboriginal Health Strategy, a very charismatic director and a few staff. I think there were 7 of us in the early days. In fact, the building was still being cleaned as we started. The Danila Dilba that we have today is light years away from what it was in the early 90s when, for a start, not many people up here knew what an Aboriginal health service was and what it could offer the local community, and certainly people didn't know about Danila Dilba. Now I think everyone knows about Danila Dilba, and it's a huge organisation over multiple campuses.
For me, health never really seemed to have a political dimension. It was just something you got a cold or you had blood pressure and you went along and you got it fixed. It was very much a biomedical dimension. But Aboriginal people understand that health is very much a political issue. It's an issue about the politics of past government policies which affect health today. It's a political issue about the way resources are distributed to meet health needs today and in the future. So if you're Aboriginal and you've grown up in a community with health problems, you'll know, you're right on the ground there, you'll know exactly what's needed and what the issues are. The landscape is littered with many mistakes made about people trying to foist programs onto communities of which they have little knowledge. You know, action without consultation.
It's important to have separate Aboriginal health services because mainstream health services have failed and continue to fail Indigenous people. They often, intentionally or not, don't listen to Indigenous people. They don't have the ability to listen to Indigenous people. They don't have the time to spend often with Indigenous people. Indigenous people don't feel comfortable there. There's not Indigenous people around. It's not set up in an Indigenous friendly way. And something that's not apparent on the surface but which Indigenous health services would not function without is Aboriginal management, Aboriginal control.
So I work mostly at the Palmerston Health Centre, and out at that centre we have a general clinic where we see acute and chronic disease clients. We also have a child health program that runs out of the Palmerston Centre. We also do a women's health clinic as well, and right adjacent to us we have our Danila Dilba Dental Health Service. Having separate women's clinics within Aboriginal health services is really important because there are some issues that culturally women do not want to discuss with men as practitioners or in an environment where there are men coming and going from that environment. Sensitive issues, especially around pap smears and sensitive women's issues, and sometimes around birthing and pregnancy as well. So it's nice to have an environment where women feel comfortable, where they know that they'll be seen by women and can discuss those really sensitive issues in a really culturally appropriate manner. So I work primarily with the child health team at the moment. I'm one of the child health team leaders. In the child health program at Danila Dilba, we do mostly surveillance healthcare. So we do mostly concentrating on the 0 to 5-year-old kids. We do routine health and developmental screens for those kids, just making sure that they aren't developing any signs of chronic illness, behavioural or learning difficulties from a young age. And we also give lots of anticipatory guidance to parents of those children. And the other thing we do with the child health program is make sure that immunisations are up to date. We do lots of education around development, nutrition, and we also look after all the children who have any chronic health problems or chronic illnesses right from birth or have developed them over the years.
If somebody has a social problem and they are stressed or distracted by grief, by addictions, by unemployment, by relationship problems, then it's very difficult for them to engage with lifestyle change or tablets to be taken when they're distracted and stressed by these other things. So we always have to have one eye on the psychological and social and spiritual dimension and the political dimension, because without attending to those and without being aware of those, we're going to miss the boat completely. We're going to have all these fantastic Western technologies, but all dressed up and nowhere to go. So the reason Aboriginal medical services do this much better is because they understand the holistic nature of health for their people.
So community services program that is not clinical that runs out of Danila Dilba. Community programs encompasses alcohol and other drugs, tackling Indigenous smoking, social emotional wellbeing, Deadly Choices, which is a health and education promotional program, and various other programs that don't necessarily fit under the clinical umbrella. The IOD program provides clinical streams at every one of our clinics that operate in Danila Dilba, but they also provide an outreach program. They do various programs with other interested bodies and diversionary activities and a lot of health promotions. Tackling Indigenous Smoking program is a program that is predominantly designed for Indigenous people to help and aid in reduction of tobacco use. So the Tackling Indigenous Smoking coincides with alcohol and other drugs team, and the primary purpose of the Tackling Indigenous Smoking program is to also have clinic stream, but predominantly do promotions and healthy lifestyles that people should have. Social emotional wellbeing program runs out of every clinic. We have a counsellor and psychologist connected to every one of our clinics to provide a holistic approach to mental health. The reason why community programs is developed is to give individuals, not everyone wants to just a band-aid effect, which is a clinical effect. What we provide is a holistic view. So a lot of the underlying problems that people that aren't identified as clinical, we help in. So we reconnect people, we advocate, we refer, we look at the elements underneath that are underlying to that person's needs. So a person could be sick, but underlying their sickness is no Centrelink payments or no housing. So Deadly Choices is an encouragement with people to attend and have health checks annually. There's also a component which with the health checks is where every individual who has an annual health check gets a Deadly Choice shirt. With the other component with Deadly Choices is the delivery of education and health promotions. We're doing that because we want to make everything a deadly choice. We want our clients to know that they're making the right choice, and with Deadly Choices it provides that avenue to do that.
It's important to have Aboriginal community-controlled health organisations because of the fact that if we don't control our own health, then we won't be able to deal with the health needs that we've been constantly facing for decades. Aboriginal health services often take on and seeing what the trends are, what the high needs are, and being able to do whatever they can, not just within the clinical rooms, but also as an organisation out there in the community.
Having the board is essential, because if you don't agree with what's happening with your health, then you go through the processes and questions or whatever about what's wrong with you and how you don't agree with the treatment that you're receiving, then you're able to go to this board and present your issues. Whereas you can't do that with the public hospital system. There is a procedure where you can go and make a complaint, but it's much easier to do it on a community-controlled board level, where people are a bit more knowledgeable about yourself, knowledgeable about the environment. It's the same thing with the health worker.
It's about us self-determining what we want to see happening at the service, and we decide on the priorities for the type of service that we provide. And if we have in situations where we have an outbreak of some sort of illness, we're able to respond much quicker because we're on the ground and we're listening to the community. And that's important, that we listen to the community. And that's why I think we've been very successful as a community-controlled organisation, or as an Aboriginal Torres Strait Islander organisation per se. Yeah.
I think it's made a lot of difference, because if the community aren't happy, they're the ones that can actually speak to the board, because they're the ones that vote the board in. Yeah.
Community control means to me having a board of management that is elected, and and an Indigenous CEO or director who then has different staff working underneath them. I think that is really important because it sets the direction of the health service. However much I think I know what way a health service should run, and whatever government thinks they know what way a health service should run, it needs the input and the authority of the local Indigenous community to say, at this point in time, this Aboriginal health service should be run this way.
In the quest to increase our funding base and what have you, we, Danila Dilba, decided with Whirlingjang and from Catherine and Central Australian Aboriginal Congress in Alice Springs at the time, that we needed to organise ourselves in the Northern Territory. And anyhow, all the Aboriginal medical services in the Northern Territory came together in Alice Springs, and we set up what's now been called the Aboriginal Medical Services of the NT, AMSANT. And the whole object of the meeting was to organise ourselves so we could lobby much more effectively in Canberra. Then AMSANT had a whole lot of big meetings across with all of the services. Every 2 years we would have what was called the Health Summit. Danila Dilba was involved in all of these. With 300 people, we used to have these big bush camps. And people would come and we'd take everybody through all of the issues. So when we did go to Canberra as AMSANT, all of people were quite reasonably well informed about what was happening, and also not going to Canberra, but also what was happening in Aboriginal health, what were the big issues. Now AMSANT also, we did that national, regional and local business with people, with all of our services. We did the national stuff. We also did international. We went to the United Nations Working Group on Indigenous Populations, and AMSAT sent a delegation.
The most important thing about having an Aboriginal health worker first policy is to be able to ensure that when the clients go to Danila Dilba Health Service that they are seeing an Aboriginal clinician from the very first point of contact. It is important because it's an opportunity for the clients to be able to talk about everything else that's going on around them, not only just what's going on, health symptoms, but also at home with family, because a lot of times it actually impacts on the health that they're dealing with, and it helps give a proper plan to deal with the health issues that they're working on. Aboriginal health practitioners have the community knowledge. They also have the clinical qualification that makes them a valuable profession for any allied health doctor or nurse to be working with. It's important that health services actually work together in multidisciplinary healthcare team approach for the clients.
We were, I'll stand corrected, but I think Danila Dilba is the only Aboriginal medical service in the country that still runs a health worker first policy.
The reason why I came here to work at Danila Dilba is because I seen my father suffer with type 2 diabetes, and plus my countrymen as well suffering at Daly River. That's where my people are. So that's why I've taken up this opportunity to become a health worker to work in this organisation to help and better for our people. I think it's important that they see a Aboriginal health practitioner first, because they may feel very comfortable at first, you know, they feel comfortable, and then it's a better way for us to get a full story. I find that a lot of countrymen, they can relate to me and they sort of feel comfortable, you know, they open out more openly to you.
When I first came to the Aboriginal Medical Service from mainstream general practice, I found this a bit of a challenge because I was very used to having those first few moments with the patient, and the first few interactions are very important for clues about why the patients come. But that now the patients see the health worker first, but that's more culturally appropriate. They know how to speak to the patient in a culturally appropriate way. They understand much more. They're living, breathing, working in the community or similar communities.
The health workers knew the family, knew the individual, knew all the family. So they had this knowledge, this health knowledge of the people in their community. So they were more valuable, I suggest, than the doctors, because they could communicate, but they also had that understanding and knowledge about the clients that they were that the doctors was about to see. So that, if you want to say it in this way, living in two worlds that was broken down to that extent that the health worker could provide good clinical advice to the doctor.
The Aboriginal Health Worker First policy is an essential part of Danila Dilba. Danila Dilba would function, but not as well as it does if it didn't have, without that policy. I like to think I'm an experienced doctor. I like to think I'm an experienced doctor in Indigenous health, but Aboriginal health workers bring a background and an expertise to all my interactions with my patients that I just wouldn't have without them.
The health worker is the heart and soul of the clinic. You know, on days when I've worked without a health worker, I felt like I've been on one leg and one arm. They also bring a range of skills, you know, specific clinical skills. The health workers here have really been excellent, and it's one of the reasons I've stayed so long, I think, here, because to work with people who I've explicitly heard say, I'm in this because I have a passion for my people and I have a passion for the health of my people. And I really respect that.
These health services need to actually be nurtured and grown to address the primary healthcare issues that they face, to be able to avoid the further costs that they're already getting through the hospital admissions and other more serious healthcare needs.
You know, we might see a bloke give up cannabis that he's been smoking heavily for 30 years. He gives it up and he stays off it. And that's just over time a relationship with us that he's built up, and he's been able to fight that, be de-stressed in other ways and lose that addiction. But also just the everyday mundane stuff about getting diabetes better controlled. You know, when it happens, when a bloke drops his 3-month sugar average from 10% to 6%, you can't wipe the smile off David's face, you can't wipe the smile off my face. The patient is so proud of himself as well.
I just think that it's an awesome place to work. Like I said, I've been here since 1996, and I think that we've got a lot to offer Indigenous people and non-Indigenous people that are willing to learn and learn from our mob. Yeah.
Being an Aboriginal doctor in this setting is really good, especially working alongside Aboriginal health practitioners and Aboriginal administrative staff, drivers, social and emotional wellbeing teams, because we can deliver a really good team allied health focus to delivering culturally appropriate care to people.
Yes, it's very important for me to help my community and work with my community to help them achieve better health outcomes.
There's still a lot more work and not to be shut out, and we have to work together for a better Australia. We can't let our Indigenous people, the longest surviving civilization with their language and their culture, just to die. We can't do that.